I'm Natalia Gandur, and I'd like to share with you the key updates in bladder cancer from ESMO 2025, a meeting that clearly marks the beginning of the era of antibody-drug conjugates and biomarker-driven cell therapy in this tumor. Let's start with the keynote 905 presented by Dr. Christoph Watzke during the Presidential Symposium. This trial combined enfortumab vedotin with pembrolizumab in patients with muscle-invasive bladder cancer who were ineligible for cisplatin. The results were remarkable. 57% pathologic complete response compared with only 8% in patients undergoing surgery alone. And 60% reduction in the risk of events together with a 50% reduction in mortality. These findings, it's important to say that established a new perioperative standard of care for patients who cannot receive platinum-based chemotherapy. In bladder cancer, in this tumor, the second case study, very important, was RC48CO16 presented by Dr. Jung Guo from Peking University Cancer Hospital in China. This trial evaluated the anti-HER2 antibody-drug conjugate disitamab vedotin compared with the PD-1 inhibitor toripalimab in HER2-positive metastatic urothelial carcinoma. The results were stunning, really, with a PFS of 13.1 versus 6.5 months, overall survival 31.6, 0.5 versus 16.9 months, and objective response rate of 76%. This study clearly showed that ADCs plus immunotherapy combined, and this combination will guide by biomarkers are highly effective and may reshape the treatment landscape for this scenario, advanced and metastatic bladder cancer. Another important contribution came from InVigor-011, presented by Thomas Pauls, which explored the use of circulating tumor DNA to select patients who truly need adjuvant atezolizumab after surgery. Although still preliminary, this work signals the start of personalized adjuvant therapy based on molecular risk. And finally, Bladder Path, presented by Nicholas James, compared the traditional diagnostic pathway with the early use of multiparametric MRI. The MRI approach reduced the risk of bladder cancer-specific death by 64% and significantly shortened the time to definitive treatment. This represents a concrete improvement in diagnosis accuracy and patient flow. Overall, ESMO 2025 has transformed the paradigm in bladder cancer, with EV plus pembrolizumab sets a new standard, ADC plus immunotherapy expand treatment options, ctDNA guides adjuvant decisions, and MRI improves early management. From Berlin, I'm Natalia Gandur, and these were the most relevant advances in this tumor presented at ESMO 2025. Thank you for attention.